I'm getting an hour and a half every 2 weeks.
Once a week, 1 hour. Yeah. Imagine.
I get my laundry done, vacuuming, and she does the bathroom and the kitchen. But she'd like to do the fridge and stuff like that, but she can't do that because she hasn't got the time.
Just to take a bath, that's all. That is not enough. At least they have to help the housekeeping also, because I got lots of, nobody will vacuum. It's hard for me to, how could I vacuum?
The seniors campaign leading up to this election is attempting to get this government to look at what is not happening for the continuum of care of seniors, and has not been happening for most of their time in this in office. We have entitled our campaign Broken Promises, because as early as their first year, 2002, in office, they promised that there would be 5,000 new long-term care beds, non-profit long-term care beds made for seniors. Dr. Baird's commission said that our home support services needed to be increased. We needed to look at a model which we all refer to as the Danish model, which means that 24/7 is available, not necessarily to everyone, but to those that need it 24/7. It keeps people independent. What that would do is not just the limited service of a bath once or twice a week, which is what happens now because it is just personal care that is given out now, but it would increase that to lighthouse work. It would take them out socializing. It would see that their shopping is done and that they have good meal preparation within their homes, and not using up outdated foods in their fridge and not just living off whatever is there, but giving them good nutritional values.
This building is classified as independent living. Well, we've kind of outgrown the independent living area of it now, because a lot of the people in here now have walkers or canes. Their health deteriorates as they get older, and they're in more of an area now where they need more help. There was some talk a while back about, as the need arose, that they would fit the suite to fit the needs of the individual, but that of course takes funding and never happened.
Their independence and their life in a much more dignified way if they can remain in their homes. There is no senior that I know that says, I can hardly wait to go into long-term care. I would prefer to stay in my home as I age and go on, so I know exactly what they're meaning. And it's very restricted, very limited what is offered to people now. Is the lack of personal care hours there, in that nursing hours should be a minimum of 3.5 hours per person per day. Now that is direct nursing care hours. And that still is below what is considered ideal, which basically the ideal would be 4. But now, at this moment, people receive 2.8 hours.
I know that people have talked about having a seniors advocate the way we have an advocate for children and youth, and I think that's an excellent idea, because I really think that, I mean, like in my father's case, a lot of these people cannot speak for themselves, and if we don't have somebody to advocate for them, then it's very easy to ignore and neglect what seniors' needs are.
It's getting to the point now where people are in need of help, and it should be made available. And it shouldn't have to cost them. I mean, the seniors, they've worked on it, you know. It's their time now. Why should they have to put out $35 an hour to have somebody come in and, you know, help them bathe or something like that because they need the help? And a lot of them don't have that kind of money. Some of them are just on the fixed pension.
We're asking people to sign this letter to say these are the concerns of the BC Health Coalition. Take care of them, take care of seniors, and help us do that by signing this letter and getting it into our health minister and to our premier. We would like to have 5,000 letters forwarded to the government at this time.